thank you for joining us on the ACEP Capital Minute, a bi-weekly look at the latest developments from the nation's capital that impact emergency physicians. I'm Laura Wooster. After my update, we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live. Today, we'll cover an update on surprise billing implementation and how you can advocate for emergency physicians, the status of the physician mental health bill that ACEP is championing, the recently introduced observation status legislation, an overview of the president's budget request, the results of the ACEP poll around the administration's new data sharing requirements, and a preview about the key issues we'll be advocating for during LAC in July. So let's start with what's taking place in Congress. There have been several important developments with respect to surprise billing, physician mental health, and other ACEP priority issues. As you know, at the end of 2020, Congress passed the No Surprises Act, which bans balance billing for out-of-network services starting in 2022, and calls for an independent dispute resolution process to address surprise medical billing. Now ACEP is working with the federal government to ensure it properly implements the policy. As we speak, ACEP and EDPMA are actually meeting with CSIO, the group within CMS that's responsible for ironing out the details of implementing the legislation as passed by Congress. ACEP continues to be actively engaged in these conversations to make sure that the final product reflects all of our hard work to date and prioritizes taking patients out of the middle while ensuring fair reimbursement for emergency physicians. On the Hill in Congress, Representatives Tom Suozzi from New York and Brad Wenstrup from Ohio are currently circulating a Dear Colleague letter in the House of Representatives that urges the administration to ensure that the IDR process in the No Surprises Act implementation remains balanced and that patient protections are preserved through the implementation process in a manner that's consistent with the intent of the law. You can urge your own representative to sign this important letter to protect access to emergency medicine for every patient who needs it by visiting our Federal Advocacy Action Center at acep.org/action center. The action alert closes on June 10th, so if you could take action fast, that'll help the members of Congress leading this important letter. Last Tuesday, the Senate Health, Education, Labor, and Pensions Committee, or HELP Committee, approved the ACEP champion physician mental health legislation, the Dr. Lorna Breen Healthcare Provider Protection Act. During the markup, the bill's sponsor, Senator Tim Kaine of Virginia, specifically thanked ACEP for all of its work on this legislation. ACEP will work with the bill sponsors and committee to advance the bill to the full Senate for consideration, while we also continue our work on the companion legislation in the House, which is HR 1667. Also yesterday, Representative Joe Courtney of Connecticut introduced a bill that should lessen the cost burden for patients who require observation status in the emergency department. Under current Medicare policy, a beneficiary must have an inpatient hospital stay of at least 3 days for Medicare to cover skilled nursing care. However, patients who receive hospital care on observation status do not qualify for the benefit of skilled nursing care, even if their hospital stay lasts longer than 3 days. So these patients are either forced to return home without the treatment their care team has suggested, or they could be billed after their stay. This congressional bill would ensure Medicare covers this doctor-recommended post-acute care by counting the time spent under observation status towards the requisite 3-day hospital stay for coverage of skilled nursing care. This legislation moves on to the Senate for further action next week. The Senate Committee on the Judiciary Subcommittee on the Constitution held a hearing last week called Stop Gun Violence, Safe Storage. This is the most recent of a series of hearings that address the issue of firearms violence and injury prevention effort. Testimony was heard from patient advocates, a pediatric emergency physician in Colorado, and others. The House is also listening to a variety of voices on vaccine readiness and hesitancy. Most recently, last Wednesday, the House Energy and Commerce Oversight and Investigation Subcommittee held a hearing entitled A Shot at Normalcy, Building COVID-19 Vaccine Confidence. Witnesses included actor Nick Offerman, global and local public health officials, and other experts. Meanwhile, congressional appropriators discussed their fiscal year 2022 budget requests with legislators, and budgets were reviewed for NIH, Department of Defense Health and Medical Readiness, and the CDC. ACEP is monitoring these conversations closely and watching for opportunities to amplify calls for funding that help strengthen the practice of emergency medicine. Now let's focus on the current administration and some of their current priorities and policies. Toward the end of last week, President Biden released the entire fiscal year 2022 president's budget. As you may recall, the administration released its initial skinny budget last month, which only included the discretionary spending section of the budget. This complete budget request now totals $6 trillion and highlights key investments that the president includes in his American Jobs Plan and Americans Family Plan. Most of the proposals included in the budget are those that this administration has already announced previously. The budget does not include specific health reform policies, but it does call on Congress to create a public health care option and to give Americans older than 60 the option to enroll in Medicare early. As a reminder, this budget request is only a marker. It serves as a sweeping outline of the presidential priorities, but would require significant discussion, negotiation, and ratification by Congress to ever see the light of day in statute. As mentioned in previous editions of Capitol Minute, new federal requirements around data sharing and information blocking went into effect on April 5th. These new rules require that patient notes, lab results, and other information be shared with patients, with some limited exceptions. ACEP created a poll last month for emergency physicians to gather our members' overall input on the data sharing requirements. The results of the poll are in, and it's quite clear that there's room for improvement in terms of the regulatory requirements themselves and how hospitals and departments have implemented them. The biggest issue flagged repeatedly in the poll was around the timing of data sharing. Specifically, there appears to be significant unintended consequences associated with sharing notes and lab results immediately, before emergency physicians are able to discuss the results with their patients. More than 2/3 of respondents in the poll stated that lab results are shared by their hospital systems immediately with patients once they are available. Respondents indicated that the policy of sharing notes right away has caused patient confusion, anger, and sadness, with some extremely compelling examples, including patients who found out they had cancer or miscarriage without first being able to discuss their diagnosis with a physician. Further, there are numerous examples of patients misreading or misinterpreting clinical notes and lab results, causing physicians to have to spend significant time correcting these misconceptions and consoling their patients. I encourage you to read this week's Regs and Eggs blogs written by ACEP Director of Regulatory Affairs, Jeff Davis, for a summary of the poll results and for some insight into how the new data sharing requirements are impacting emergency physicians and patients. Hopefully, you are registered for ACEP's Leadership and Advocacy Conference scheduled for July 26 to 28. This event is an incredible opportunity to advocate for your specialty and patients. We've identified the core issues on which we will focus, and invitations to an impressive roster of speakers from Congress and the administration will be confirmed in the weeks ahead. The 3 headlining issues for LAC this year will be patient access to MAT, prioritizing physician mental health, and protecting emergency physicians from harmful reimbursement cuts. You can explain the critical role of the emergency physician in treating opioid use disorder and advocate for increasing patient access to MAT, including steps like eliminating the X waiver. You'll have a chance to discuss the Breen bill and have an opportunity to share your personal experience with legislators. You can talk directly to Congress and encourage actions that empower emergency physicians, encourage hospitals and care teams to better address mental health, and address the stigma that prevents physicians from seeking the help they need. You'll also be able to break down what it means to you and your patients when reimbursements are cut. Emergency physicians face several Medicare cuts that have been delayed due to COVID, but will be back on the table and put into effect at the end of this year unless Congress takes action to prevent them. This conference is a perfect time for you to let your voice be heard, network with colleagues, and affect change on the national level. You can register to attend online at acep.org/LAC. Space at the hotel is filling fast, and we look forward to seeing many of you in person soon. DC has moved to a full reopening for June 11th, so museums, bars, sports venues, and restaurants will be open while you're here. That concludes this week's Capitol Minute. As a reminder, this episode and all others are available at acep.org/Capitol Minute. I'll be happy to take your questions now. See if we have some coming in. Is the college worried that surprise billing implementation could go poorly? I don't think we're worried that it could go poorly, but I think we're being very careful and taking all the steps necessary to ensure that it goes as well as it can. There's a lot of kind of parameters around that, mainly being the statute itself that was passed by Congress, which we worked heavily on. And in the end, we're able to shape into something that was a lot less damaging than the original proposals that started in Congress back in 2019. So we've been taking a lot of proactive steps in order to help guide implementation. We partnered with EDPMA on developing a really detailed letter that we sent to CSIO and the other departments that are implementing the law to help inform what they're doing. It really was one of the first major letters that went to CSIO among physician and hospital groups. So we really kind of led the charge on that and got our input in early, which I think can help inform the rulemaking for this. They're on a really tight schedule. The law requires that the first part of the regulation is out by July 1st. And so that's soon. We're hoping that that's going to be in the form of a proposed rule with comments, so that we could offer our comments to whatever they kind of came out with as a first stab, and then kind of have a chance to shape what comes out as a final rule. But given that tight timeline, I think it's going to end up, unfortunately, being much more likely that it's an interim final rule with comments. So basically, they put it out. There is no proposed rule. They put out this interim final rule, presumably by July 1st. And you can provide comments, but it's already in place. So unlike a proposed rule, which doesn't go into place until the final rule that takes into account everyone's comments is done, this one is a little harder to walk back if there's damaging things in it. So if the interim final rule has approach that would be damaging to emergency care, we'll of course comment and try to weigh in heavily on pushback on that, but it's a lot harder to kind of undo than a proposed rule that's damaging would be. But meanwhile, again, we're taking all the proactive steps we can. We're, like, as I said at the beginning, we're meeting with members of, CSIO staff as we speak, along with EDPMA. So that meeting is going on right now. And we're hoping that that makes an additional push. We participated with other physician and hospital groups in a listening session that CSIO held about a month and a half ago. But this meeting today is an individual one, just with our organization. So it's focused strictly on emergency care, which I think is an important distinction. And then, like I said, we had sent in the first letter as well as the second letter. So we're really hitting this hard. Congressionally, we've been working with offices, including the ones that put out that letter, that Dear Colleague letter that we're hoping you all can sign on to our action center and help get additional support for. So that was a long answer to what we're doing to make sure that surprise billing implementation does not go poorly. Let's see. Question, any word on how the CSIO meeting went? It's still ongoing, so presumably everyone who's participating in it is concentrating and not texting me updates, but I'm also doing this, so I haven't checked my phone yet, but I'm sure we'll have a summary and some information for folks following the meeting to let everyone know how it went. Let's see if there's another question. Do we think that the Lorna Breen bill has a good chance of passing Congress, and what's the time frame? What if it passed before we arrive for LAC? I do think it has a decent chance of passing. I think there's been a lot of attention to the issue of providers and mental health and some of the barriers they're facing, especially during the COVID pandemic. I will say there's a bigger push now by Democrats in Congress to push for additional support for all Americans on the mental health side. And while I think that's a great thing, we want to make sure that the providers don't get lost in the shuffle on this, because if providers aren't taken care of, they won't be able to then support all the Americans who need their own mental health care. So that's something we're really hitting hard. In terms of time frame, I think it could happen this summer. If not, it would probably be at the end of the year. And what if it passed before we arrive for LAC? I think it's less likely that it would pass the House before LAC, just because it's not as far along in the House process. Whereas the Senate, it's been marked up and it's out of committee, so it's ready for a full Senate vote whenever that would take place. If it did pass the Senate before we arrive for LAC, what we would do is in Senate offices, we would just thank them for their help on it, and then just move on to the other two issues. Whereas in the House, we would fully advocate for the House to take immediate action on it. If it passed both before we arrive for LAC, we'd be really excited and celebrate that with you all while you're here. And then instead of the Lorna Breen bill, we would most likely speak on pandemic preparedness and ensuring that emergency physicians and departments have the resources they need, both financially and otherwise, to be prepared for a future pandemic. All right, we have another question coming in. What is ACEP doing with the results of the data sharing poll? Do we think the administration will make any changes? So we're continuing to go through the results. So there were two parts of the survey. There were, of course, the multiple choice responses, but there was several areas where we asked for kind of free text information. And so we're still analyzing the free text, and that's where we've got some, I think, really powerful anecdotes about what has happened already with hospital systems that have allowed patients to immediately see results that really are unfortunate for them to see without being able to discuss it with their emergency physician first. Then the other thing flagged is instances where the wording of that a physician used, some clinical terminology, is misunderstood by patients and almost taken as offensive to them. And so that's something that will need to probably be some adjustments on. We are going to be sharing the results of that with the Office of National Coordinator for Health IT. And so that's the area within CMS that oversees health information technology and EHRs. ONC is actually who asked us to do the poll. They had reached out proactively to us to discuss how implementation of the data sharing requirements are going. And so we offered to do a poll to get them kind of broader information on this. So we had a really good response. And I think the fact that they were asking for input is a great sign that they are open to making any needed changes or adjustments. So hopefully they'll take a look at our results. I know the AMA also did a survey, but that's much more focused on scheduled care. And I think emergency care, this is one of those things where emergency cares, the uniqueness of emergency care makes it really important for the agency to hear from us in addition to groups like the AMA. So we are going to present that to them. I think we're having a follow-up meeting with them sometime in the next month or so. So there'll definitely be more to come. If there's changes that ONC potentially might want to make but can't because they still have to adhere to the law passed by Congress, so there's some things that are kind of too big of a change for them to make, then we would potentially pivot to a congressional strategy and approach some members of Congress to maybe write legislation to fix whatever ONC can't fix on their own. Another question coming in. What is the college doing to push back on the AAPA's announcement to change the name from physician assistant to physician associate? Yeah, that's been a really big topic of conversation over the last week or two following the announcement by the AAPA that I think they voted in their version of the council, their House of Delegates, to change their name from physician assistant to physician associate. And a couple things to keep in mind for that is that they themselves recognized in doing so that the change doesn't hold any weight until it's changed in state and federal legislation, because right now they're recognized as physician assistants in law. And so just because you rename yourself physician associate, just like in branding, it doesn't mean that would be recognized in law. So they would now need to do a lot of work at the state and federal level to try and get that changed in law. So that's ongoing. So what did ACEP do? ACEP, we put out a statement pretty quickly, I think within 24 hours of that, reemphasize, kind of pushing back on it and reemphasizing the importance of physician-led care in the emergency department, especially. Other things we're doing is we're having conversations with other organizations that are also concerned about this to see what we can do. I know our leaders also talked with the leadership of SEMPA to see what their take is on it. And then ACEP had recently joined the AMA's Scope of Practice Partnership. So this was really good timing because that gets us access to a lot of additional resources and brings us together with the rest of the House of Medicine that's participating in that to push back on things like this AAPA announcement. I think the last and maybe one of the most important things that we're doing is we'd already had started looking at, and now I think this kind of highlighted all the more need for, and so we're speeding things up, is a PR campaign to highlight the value of physicians in emergency care, of emergency physicians. So highlighting the level of training and expertise you all have, as well as empowering patients to ask, to feel comfortable to ask for a physician when they receive emergency care. So that's something that will be going out to the public probably in about a month or so. And hopefully you'll keep an eye out for that. And I think being able to really inform the public on the differences in training and the level of expertise and training that you guys go through to be board certified emergency physicians will really help kind of stem the tide of some of this APP kind of encroachment on the emergency physician workforce. So stay tuned for that. Last question just coming in. Thanks for sharing the LAC topics. Any other sessions we should look out for? Yeah, no, that's a good question. We'll have in the morning, on Monday morning, I know that ACEP President Mark Rosenberg and several others will be holding a town hall on the workforce issue, the recent workforce report that is coming out, and a lot of the concerns around that. So they'll be presenting the latest ACEP activities to address that, as well as take questions and listen to participants sound off on this. So if that's an area that you're concerned about, definitely encourage you to come to LAC, because you'll have an opportunity to directly speak with our leadership on this. Other topics, sessions that we're looking out to have, we're probably going to have a panel on health disparities with some key congressional folks that are working on this issue, as well as some emergency physicians who have been advocating for changes there. And then we're also hoping to hear from several members of Congress who have worked on the bills and issues that you'll all be speaking about on the Hill that day with congressional offices. So should be a pretty good program. And we're excited that DC is opening back up so that LAC attendees can enjoy other aspects of DC while they're visiting. And we're looking forward to it. So with that, thanks for checking in again, and we'll be back in about 2 weeks. We'll be back in exactly 2 weeks, sorry. And again, you can always check out past episodes at acep.org. Thanks again.